Hey everyone, it is Dr. Jorge coming to you today on another Wellness Wednesday, talking about a subject that is actually very personal to me because I have it, and that is sleep apnea. Sleep apnea is when you cannot get enough breath while you're sleeping and you actually stop breathing for a short period of time. Now, I have been told in the past, well, actually, somebody described me as the Celine Dion of snorers. Not sure what that means, but I don't think it's good. But basically, what it was saying was that I was snoring very loudly. And I've also been told that I stop breathing during sleep. Someone that has sleep apnea will basically wake themselves up with these violent snores to try to catch their breath. So, sleep apnea would go something like this. And then you wake up and you have restless sleep all night. You never go into REM sleep and you wake up fatigued. Sometimes you fall asleep while you're driving. Actually, some of the symptoms of sleep apnea are beyond the snoring. You can have sleep apnea without snoring, even though it's unlikely, and have some of these other symptoms: high blood pressure, fatigue all day long, falling asleep while you're driving, waking up with numbness or tingling of your fingers or your arms, having restless leg syndrome while you're sleeping. All of those can be symptoms of sleep apnea. So if you suspect that you have sleep apnea, what do? Well, you go to your doctor because now there are simple tests that you can do in home to test yourself for sleep apnea. In the past, you had to go, and you still can, go to a hospital or a sleep disorder center and sleep there. Now, I don't like that because that is not normally where you sleep. You normally sleep at home, so you want to get a much more realistic sense of what's happening. With some sleep apnea tests, they can actually send you a kit where you put some prongs in your nose, this band here that measures your brain waves, and for a couple of days while you sleep, your pattern of sleeping will be recorded in this little computer. That is then sent off and analyzed. And if you have sleep apnea, the good news is that there are treatments for sleep apnea. Sure, sometimes, but rarely, surgery can help you have a much more open airway. One of the most important things, though, is to lose weight. Physician, heal thyself. But if none of that works, you could actually, and I recommend that you do until you can do the other things, is to wear a CPAP machine. A CPAP machine can either be a mask that can go over your nose like this, or over a mouth like this, or two nasal prongs. And what it does is it forces oxygen into your sinuses, into your pharynx, so that you actually get oxygen while you sleep and don't have to gasp for air. What does this do? Quite simply, it is going to make you feel much less tired during the whole day. You're going to have a lot more energy. It'll probably correct your high blood pressure. You will actually probably lose weight if you're on a CPAP machine, and it probably will correct a lot of the other symptoms and diseases that you didn't know were related, all right, to sleep apnea. Now, I am not the best patient. I got to admit it. Sometimes I fall asleep before I even put the CPAP on, and I don't always wear it because I don't think it's sexy. So we have a jar at home, and every time that I don't put on my sleep CPAP machine, I got to put in $10 in there. And unfortunately, the CPAP jar is almost going to pay for vacation. But one of the reasons I'm doing this is because I think it's going to help me. And if it's going to help me, I want it to help you. If you have any of these symptoms, please test yourself out for sleep apnea. Go to your doctor. Tell them your concerns. It could revolutionize your life. You could feel better. You could be more energetic. You could do better at work, at home. It's a win-win-win. So this is Dr. Jorge signing off today on Wellness Wednesday, talking about sleep apnea. And you know what? Next time we talk, I am going to tell you about my progress and whether I have become a better patient. So knowledge is power, and I'll see you next week.